Dr. Anthony Fauci made a public appearance recently, and Americans are trying to discern whether he is a hero or a villain. Meanwhile, RFK Jr. is doing his thing to resuscitate America's health. Hi, I'm Rex Rogers, and this is episode number 273 of Discerning What is Best, a podcast applying unchanging biblical principles in a rapidly changing world and a Christian worldview to current issues in everyday life. Now, I confess that I've never been a fan of Dr. Anthony Fauci, America's pandemic czar during the first Trump and then Biden administrations. He was director, National Institute of Allergy and Infectious Diseases, later Biden's chief medical advisor, and for a time something of a media darling. Now he's facing serious questions regarding whether his pandemic recommendations, like masking, vaccines, and long-time school closings, were wise and necessary, or ill-advised, scientifically questionable, or another example of government overreach. Worse, some allege Fauci lied about the source of the virus, his involvement with gain-of-function research, whether he believed his own recommendations, and whether he profited illicitly from this awful time in the nation's history. At a minimum, with the recent release of his private diaries, he's come off as a narcissistic prima donna. Meanwhile, at the start of President Trump's second term, he appointed RFK Jr. Secretary of Health and Human Services, and RFK has become known for his Make America Healthy Again, or MAHA mantra, wherein he purports to be doing all he can to rationalize medical research science, hold pharmaceutical companies accountable for their claims, and in general raise the quality of the American food experience. Among other things, RFK Jr.'s goals involve improve the American food supply, reduce consumption of ultra-processed foods, reevaluate artificial food dyes and certain additives, increase ingredient transparency, promote healthier school meals, and then combat chronic disease, reduce rates of obesity, diabetes, cardiovascular disease, and other chronic illnesses, emphasize prevention through nutrition, exercise, sleep, and healthy lifestyles, focus particularly on children's health, and then increase government transparency and scientific integrity, review environmental contributors to disease like pesticides and microplastics, reevaluate vaccine policy, promote precision or personalized health, improve maternal and child health, address mental health and substance abuse like the opioid epidemic, and encourage healthier lifestyles. It's an extensive list. As I admitted earlier, I was never a fan of Dr. Anthony Fauci, and am even less so now. Frankly, I think the guy lied repeatedly to the American people and should somehow be held accountable, even though President Joe Biden preemptively pardoned Fauci from any crimes related to his work and service. As to RFK Jr., it's another story. I used to regard him as, so to speak, just another Kennedy, who moved through life living large off his family name and wealth, but didn't do a whole lot. But RFK, to his credit, has admitted and owned many of his youthful indiscretions, as candidate Barack Obama once called his dalliances with marijuana. RFK Jr., it seems, is a different man than he was back then. He's matured. Hopefully we all have. So I've learned to appreciate RFK's vision, steady commitment, and the vigorous communication of his desire to improve America's health. I've listened to him a lot, and I believe him. I especially like RFK Jr.'s initiatives to restrict food dyes and ultra-processed foods in schools and addressing chemical additives. Now, some 40% of the U.S. food and beverage industry has committed to removing artificial dyes from their food, while HHS, that's the Health and Human Services, has redirected $1.8 billion per year to combat the childhood chronic disease epidemic. I don't look at all this as partisan. In fact, I specifically try to sidestep across the aisle rancor and look at what maybe could be done to address what is a large-scale health imbalances in the U.S. HHS agencies are bringing together their collective expertise to evaluate prescription patterns for psychiatric medications, their benefits and potential harms, and elevate the role of non-medication treatments and scalable, evidence-based solutions to improve mental health. HHS is working to prevent the unnecessary initiation of psychiatric medications and support the tapering and discontinuation for patients not experiencing clinical benefit. HHS highlights non-medication approaches such as family support, psychotherapy, nutrition, and physical activity when clinically appropriate. Secretary Kennedy has said for too long Americans have been forced to pay exorbitant prices for the same drugs that are sold overseas for far less. That ends today. We expect pharmaceutical manufacturers to fulfill their commitment to lower prices for American patients, or we will take action to ensure they do. HHS expects each manufacturer to commit to aligning U.S. pricing for all brand products across all markets that do not currently have generic or biosimilar competition with the lowest price of a set of economic peer countries. These targets will, we trust, drastically bring down U.S. drug prices, which are often 3 to 5 times higher than prices abroad. I hope so. For too long, in my view, Americans have been taught to medicalize every personal, emotional challenge, or to call something mental health as a quick-off diagnosis. As soon as a person gets in trouble, they have mental health problems. Happens to athletes all the time. Of course, it could be. Genuine psychiatric and mental health issues exist. I'm not discounting this. I'm simply saying there's sometimes more to the story, which is to say there are spiritual roots to our emotional and mental health issues. I believe it's possible for human beings to get themselves so deep into problematic attitudes, feelings, and behaviors that they cannot extricate themselves. They've perhaps gone years in a downward spiral, which yields other problems too. They no longer have the capacity to make decisions they should make to get help. Perhaps they need an intervention. That said, I also do not think there is anything, catch that, anything that we can get ourselves into where we are beyond the reach of the Holy Spirit of God. Submitting to His will and seeking His forgiveness can enable individuals, literally with God's help, to change their destructive behaviors, to begin to change their lives. This is not just tough love or self-help. It is biblically Christian theology. So I'm in favor of HHS reviewing the quick trigger diagnosis that everything is a psychological, emotional, mental health issue that just requires some medication to fix. Food is a tremendously important matter, too. The Bible has a lot to say about food, not just what people eat, but what food symbolizes, how it should be received, and how it relates to God and other people. Food is a good gift from God. It should be received with gratitude. Self-control is important. Gluttony is discouraged. Under the New Testament, no food is inherently spiritually unclean, and believers should avoid judging others over food and should act in love and consideration. Food also serves as a powerful symbol of God's provision and our relationship with Him. God created us physically, mentally, emotionally, spiritually. He is engaged in our lives and this world, and He's given us the reasoning capacity and responsibility to care for ourselves and the world. That includes food, medicine, and certainly our own and our loved ones' well-being. I think government, also created by God, has a place helping us assure our food, health, safety, security, and ability to flourish are protected, preserved, and promoted. For me, that means holding someone accountable who, like Dr. Anthony Fauci, misdirected us, and it means empowering someone like RFK Jr., who is working to improve our lot. Well, we'll see you again soon. This podcast is about discerning what is best. If you find this thought-provoking and helpful, follow us on your favorite podcast platform. And for more Christian commentaries, see my website, REXM, as in Martin, it's rexmrogers.com, or check my YouTube channel at Dr. Rex Rogers. And remember, it is for freedom that Christ has set us free. Stand firm.